Good afternoon, tribal membership, Winnebago community, and the Winnebago workforce. This is the weekly COVID-19 update. And I wanted to start off by acknowledging our family that's in mourning. Rita Redhorn yesterday had passed away, and we're real respectful of that and understand that what's going on out there. And so we postponed, we was gonna have this yesterday, but we wanted to pay that respect the way we always have. And yesterday in the evening time, I went to the family and I expressed my thoughts, on behalf of myself, on behalf of the tribal council, and on behalf of what's going on, that we wanted to be respectful and do that for them and support them in this time. And also that we understand that we have to keep going during this pandemic for the safety of our people. And I wanted to share that with the family, and so I did. And on behalf of us, that's what we wanted to do, and that's what we wanted to make known. And on behalf of all the mourners, we've lost members of our tribe in these past few weeks, and a real hard time for our people. But we understand, that this is the way it is, and we have our ways, and we're going to continue, the way we know how. Our ways are real applicable to all parts of life, no matter what time, applicable today. And I also wanted to say something, when I talk, I always say that I don't say anything unless I have something to say, or if I feel something needs to be said, or if I'm asked to talk with my position, I'll do that every time. And at this time, I feel that something needs to be said for the young woman that lost her life this past weekend in our community. She was a member of ours, she was one of ours, a member of this community. And I was there, and as part of my duty in law enforcement. And I said prayers on her behalf, on behalf of her children and what happened, and the area, that was the first thing I wanted to do when I arrived. And so I tried to take care of that the best way I knew how. And tomorrow there's going to be a candlelight vigil that's being organized by some people, and that's real good that we try to come together and understand and that she had children and that she has family, and that there's a lot of people affected by this. So I wanted to say something, because I thought something needed to be said. So I wanted to take care of that. And if you want to take care, myself, I want to take part in that, but maybe I'll do it from home, and say some prayers at home and light a candle and let them know that I care, and that I'm thinking of her children, and I'm thinking of our whole community. So with that, I wanted to express those many things and move it along to DANELLE Smith, our CEO of the 12 clans. Thank you.
Thank you for those words and comments. I just want to say good afternoon to everyone, and thank you all for joining today's live stream. As was mentioned, we canceled last week's live stream due to deaths in the community, and postponed yesterday's event till today. We're really working very hard to try to provide current and updated and accurate information for the community. We understand how important that is, and so we're just really trying to balance our respect for those families that are in mourning, along with our need to provide updated information to the community during this time. Really appreciate everybody who's joined the live stream today. Again, we know how important this information is for all of you, and in addition to the live stream, we're working on other ways to make sure this information is disseminated out to the community. We understand that not everyone has Facebook or has internet access and those types of things, and so we want to make sure that we address that and can provide this information that's very important to all of you in a variety of ways so that it gets out. So we are acknowledging that and are working on it. As was mentioned, the last couple of weeks have been especially difficult for our community. And I too, along with the rest of our staff, would like to express our condolences to all of the families who have lost a loved one during this time. And it is especially difficult because here in our tribal community, it's during these times when, you know, it's in our culture and our beliefs for us to come together and be together and to you know, to go over there and show our respects and provide that support to our loved ones. But during this time of a pandemic, it's especially difficult in order to do that because we also have to keep ourselves and keep our families safe. So really just want to again express my condolences to all the families that are in mourning. We have a lot of information to share with you and updated information today. So again, thank you for joining. And at the end, we will have a question and answer session. Emily Longuski usually facilitates that, so I'm going to be helping with it today since she's not available to join us. So right now I will turn it over to Mona to start with our presentation. Thank you.
Thank you, Danelle. Thanks, Sean, for all the good words and the respect that you have for our community and our mourners. I also wanted to share my thoughts and prayers to all the families that have been touched by the losses over the past weeks. There are a few items that I wanted to touch upon. One was, as soon as we get a positive case in Winnebago, we do issue a press release. So I wanted to make sure that the community understood that. We don't hold on to them until the lives. We do get them out the same day that we receive them so that the community has the most up-to-date information. I was also wanted to remind people that even though the CDC has come out with some additional language that COVID doesn't live on surfaces as long as they once believed, that does not mean that we don't continue to disinfect our surfaces. So I've had some texts and inboxes that wanted me to share that with the community today. So we must continue to wipe down surfaces that come in contact with others, such as door handles, phones, remotes, or any other highly touched areas. So we want to continue to be vigilant and disinfect. I also wanted to say happy EMS week. Our medical services division is comprised of the most dedicated people from our motor vehicle operators, getting people to their appointments outside of this area, our community health representatives that do screenings, and our first line of defense in getting people into the hospital for medical care, to our emergency medical technicians that are working tirelessly to try and get people the medical services that they need. Us in EMS, we kind of joke sometimes, and I'm sure some that work with us. And I came across this poem that I think sums up kind of what we do. It says, I am your lifesaver. I am your psychiatrist. I'm your cardiologist. I'm your internist. I see you at your worst when you're broken, and I pick you up. I lift you when you cannot stand. I hold your hand when you're scared and crying. As my heart breaks, I tell you the worst news of your life. I am your EMT. I am your EMS. And I want to thank each and every one of you for all that you do for our community. We are all in this together, and we continue to work towards our common goals. Again, I want to thank all the staff that are working through this stressful time and all of those that work behind the scenes. All of us are at risk for COVID-19 infections, so continue to stay home, stay healthy, stay connected. And now Angie Keller, our Public Health Nursing Director, will start this week's presentation.
Good afternoon, everyone, and I do want to take this time to give my sympathies to everyone's families and friends that have lost somebody this week or the last couple of weeks during this difficult time. But we'll go ahead and get started with the COVID preparedness and response presentation for the week. The most current numbers that we have are for the COVID statistics are within the United States, there's been 12,601,143 cases. Of those, there's been 10,811,428 negative test, 1,699,370, we'll go 75 positives. And then in the United States, there's been 90,340 deaths. For the state of Nebraska, there's been 72,333 total tests completed. Of those tests, 61,289 have been negative. There's been a total of 10,846 positive cases in Nebraska, and there's been 132 deaths. Within Winnebago, there's been a total of 70 tests. Of those 70, 61 have been negative. There's been 9 positive, and 5 of those positive have recovered. There has been 1 death. With the non-Winnebago residents, so those individuals living outside Winnebago, there's been 94 tests that have been completed. 73 of those have been negative. There's been 22 positive. And then for the risk exposure, so it's been changing to more high and low risk exposure. So this is what we would do to determine anybody that's at high risk exposure from a positive case to do contact tracing. So with that, slide's been gone over a couple times, but the individual in the white circle, the woman there, she would be the positive case. And then the people within the blue circle are the ones at high risk. So those could be that they are household members, close family members, or that she's had close contact with those individuals. So that could be she's talked with them within a 6-foot distance for greater than 10 minutes. And then those individuals between the blue and the black circle are those considered to be low risk exposure. So those could be contacts of her close contact, but they are low risk. Those are other individuals that have had social interactions or short duration contacts with a positive individual, or with a close contact of a positive individual. So those would be in line with if you walked by somebody at a grocery store, or if you held a door open for somebody as they walked into a gas station, or if you're pumping gas at them with someone that was positive at a gas station. So those are just very low contact exposures. But with that, it is important, with more things opening up, and as bars and restaurants are opening and things like that, it's really important that you still maintain that social distancing guidelines and wear your mask. That's going to be your most effective source of prevention from COVID-19, along with good hand washing, and then cleaning, as Mona said, to continue to clean those high frequency surfaces. And then with that, if once a positive case is identified and the close contact or contact tracing is completed by the public health nursing department, you will be contacted. So every individual that is deemed to be a close contact will be notified of that and will be advised to quarantine. And then the public health department will be checking up with you daily as well to make sure that if testing is needed for you or your family, or if symptoms develop, or to give you guidelines as to when the quarantine can be lifted. As that, with any questions, there is that COVID hotline that's available. The number there is 402-922-1508. The hours for operation are Monday through Sunday or Sunday through Saturday, 7 days a week, from 8 a.m. to 8 p.m. If you do call after hours, you can leave a voicemail, or you can send a text message also on that hotline, and then someone will respond to you as soon as the next day as the operation hours start. If there's emergency or emergency services are needed, we do ask that you contact the ER at 402-878-2501, and then get medical attention from the ER. The information you'll be asked during any calls for the hotline we'll get your name, location of residence, the community you're living in, the reason for your calling, a good contact number to reach you at if the number that you called at isn't effective or is not a good contact number, and then any symptoms or anything related to COVID. So if there are issues related to the COVID infection, we will do that. If it's other questions, we could refer you to your family provider just to get you the information that's needed if it's not COVID related. And then next, Laura Gamble will go over all the changes or the testing prioritization at 12 Plains Unity Hospital.
All right, thanks, Angie. Good afternoon, everybody. I know it's been a tough week, and I offer my sympathies, and thank you so much for taking the time to be on this live stream today to hear all the updates. So right now, we get a lot of questions about testing process and prioritization. So I want to go over that with you. So not everybody needs tested for COVID-19 as of right now. They still have the prioritization list, but that is opening up every. It seems like every week they look at changing that. So testing is not an emergency situation. Even if you are supposed to be tested, it really isn't an emergency situation. And really, most people will have mild illness and can recover at home in self isolation without medical care and may not even need to be tested. And again, Angie and her team have been doing a great job about telling people who needs to be tested and when and how they can get tested. If you think you need testing, please call the COVID hotline. If this is after hours, you can leave a message and someone will get back to you. You will then receive instructions on how to and if and when you need to be tested. If you are experiencing an emergency and need care, that is when you need to utilize the emergency department. And we want to stress that. So if you do need emergency care, please come to the emergency room. Please inform the screener you are wanting to be seen in the emergency department and you are seeking care. Those coming to the hospital just for testing will be given instructions to call the hotline or maybe their primary care provider, so an informed decision can be made as to if testing is warranted or not. Those living in the same household or have worked with someone in close contact that is COVID positive will be advised as to when and if testing is needed or when it is to be performed. And really, you have to look at when there are some criteria as to when you were exposed. So it's good to get some advice from somebody before you just go and get tested. All right, next slide. All right, here are the priorities. So hospitalized patients with symptoms get tested, healthcare facility workers, workers in congregate living centers. So if they work in nursing homes or group homes, first responders with symptoms, residents in long-term care facilities or other congregate living settings, including prisons and shelters, and those with the symptoms. There are priority people, persons with symptoms of potential COVID infection, including fever, cough, shortness of breath, chills, muscle pain, new loss of taste or smell, vomiting or diarrhea, and or sore throat. Persons without symptoms who are prioritized by the health department or clinicians for any reason, including but not limited to public health monitoring, sentinel surveillance, or screening of other asymptomatic individuals according to state and local plans. So the health department might say we want to test you even if you're asymptomatic, but they will let you know. If COVID-19 testing is warranted, meaning the criteria is met, then a test may be sent to an outside lab. Current turnaround time for test results is approximately 1 to 2 days. There are tests available for rapid COVID testing on site, depending on the symptoms that are present or type of exposure. We do not use that rapid test for people that don't have symptoms. You have to be having symptoms for the rapid test. We have been working on ways to collect specimens so that we are limiting exposure to staff and other patients. And that may be, we may ask you to come to a drive-through testing spot that we have set up at the hospital. All right, types of testing available. We review testing processes and testing supplies on a daily basis at our daily safety huddle. We have to know how many tests we have and where the tests are going. We have to ensure that we have enough supplies to last long term. So it's important that we follow prioritization processes. The Abbott ID Now testing or the rapid testing. This test can be done on patients who are having symptoms. If we need to test someone that does not have symptoms because they are a healthcare worker, live in the same household, or in a congregate living situation, a commercial lab will have to be used with return results of 24 to 48 hours. They've been pretty good. We've been getting them back pretty fast. There may be times when a second test will need to be done for validation purposes of the rapid test. We currently are using these tests as much as possible when it's applicable. So commercial and state labs, most of our testing is being done at the commercial lab, and that's Quest. And the results have been coming back as soon as 24 hours. We have more testing supplies available for our commercial and state lab testing. I want to go over quick Test Nebraska. This is an option for outside testing. You go to Test Nebraska, www.testnebraska.com for more information, and you can see if you're eligible to be tested. There's a short survey to fill out. All right, next slide. All right, safety for all is a priority at the hospital, and we wanted to go over some things that we have updated recently for our screening and our visitor policy. So patients and visitors' temperatures will be taken at the door to ensure appropriate and safe care is given upon entering the facility. Prior to this, we had just been taking the employees, but now we are adding the patient and visitors. The screener will ask patients and visitors to place one of our surgical masks on before entering the building so that we can ensure that masks are fitting appropriately with a good seal. We've had some issues where people have come in with their own mask, and that's great, and we appreciate that, but sometimes there's not a good seal on them or they're broke. If a patient is unable to navigate through the hospital, we will provide staff to help with this. This will limit the chance of exposure to all. So then our visitor policy, it really remains the same, but I just wanted to stress what it is. No visitors are allowed in the healthcare facility. In the case of a minor or a person with limited ability to understand or communicate, only one accompanying adult is allowed. The policy has been put in place to limit possible exposure of staff and other patients to COVID-19. We do have positive patients coming into the facility, and we do want to limit the exposure to anybody else that's in the facility. We ask that you help us enforce this policy and be understanding when you are asked to leave the facility. Our staff is doing a great job. Community support, respect, and patience is very appreciated. All right, we did begin telehealth visits. They're going pretty good. We've had some connectivity issues, but I think we're getting those fixed. And so a few of you may have had a telehealth visit, and we appreciate you being patient with us on that. But we are taking appointments. They're not always available for every type of visit. Patients will need to confirm with the hospital staff if their visit qualifies for a telehealth appointment. The hospital will work with all eligible telehealth patients, regardless of access to technology or internet availability to provide telehealth capabilities. And you can call 402-878-3404 to ask questions about that. So on behalf of the entire WCH team, thank you. If you have any questions, please stay tuned until the end of the Q&A session. Questions can be submitted in the live stream chat or via covid@winnebagotribe.com. Thank you.
Thank you, Laura, Mona, Angie, and DANELLE. I believe at this time, correct me if I'm wrong, but DANELLE, we go to the CEO, correct? Are you guys done with your presentation?
Yes, that's right.
Okay. And on the line, we do have Esther Mercer, the Winnebago Tribe CEO. Esther, are you there?
Yes, I am. Good afternoon, Garen.
All right, the floor is yours.
Okay, thank you. Good afternoon. On behalf of the Winnebago Tribe, I would like to thank you all for joining us today. I would also like to offer my condolences to the mourners and would like to thank the Harden family for giving us permission to move forward today. The tribe has received $6.2 million in funds through the CARES Act. The tribe, in conjunction with the Pandemic Task Force, have been meeting frequently to identify and prioritize community needs in order to develop the budgets for these funds. The budget has been completed, was reviewed by the task force this past week, and was recommended to be presented to the Tribal Council for final approval. I am pleased to report that the budget received final approval by the Council today, and more information on how these funds will be expended will be provided to the community at the update next week. In addition to those funds, the tribe has also received an award in the amount of $56,799 from the Bureau of Indian Affairs. These funds will be split between the Human Service Department and the tribe's wake and burial programs to assist with COVID-19 related expenses. Some departmental updates from the tribe. From our Human Resource Office, the Winnebago Tribe of Nebraska is still accepting applications for vacant positions. However, only positions that have been deemed essential and allowed per funding source requirements will be advanced through the hiring and selection process. For questions on specific positions, email the Human Resource Department at hr@winnebagotribe.com. You can review and apply for vacant positions by visiting the Winnebago Tribe of Nebraska webpage and clicking on Tribal Employment. From the tribe's Higher Education Office, the tribe unfortunately will not be able to support the Summer Youth Employment Program this year. We understand that this is a disappointment for many of the youth in the community who look forward to working over the summer. The risk associated with the COVID-19 virus, however, is far too great at this time to place our youth into a work environment where they could potentially be exposed. Further, the funds to support this program are not available due to the closure of the casino. Additionally, due to the lack of funding, the higher ed program will not be able to provide grade incentives for the spring semester 2020. From the tribe's planning office, to date, the tribe's planning office has applied for $2,262,307 and has received $1,840,301 to support the tribe's effort in combating COVID-19. This total does not include the Treasury funds in the CARES Act. The tribe is currently building a new halfway house facility. The former building was demolished a few weeks ago, and a new building will be constructed soon. The planning department would like to share the following citizens' participation notice with the community. The Winnebago Tribe of Nebraska is seeking citizen input into our plan to apply for funding from HUD's Indian Community Development Block Grant, ICDBG, imminent threat funding provided under the Coronavirus Aid, Relief, and Economic Security Act, Public Law 116-136 CARES Act. Up to $90,000 in funds is available to our tribe to support projects to prevent, prepare, and respond to coronavirus and for emergencies that constitute imminent threats to health and safety. In lieu of conducting a community meeting in this time of social distancing, we are asking that any citizens provide input by calling our tribal planning office at 402-878-2272, extension 2703, or by emailing your comments to joyjohnson@winnebagotribe.com. The tribe intends to submit a proposal in June 2020 for $900,000 to support construction of the 10-bed halfway house in Winnebago. This would complete the funding package required to fully fund this initiative, which has been planned for the past several years and has been a high priority project for the tribal council and the community. Additional funding for the total project budget of roughly $2 million is already in place from the U.S. Department of Justice and other donors. The construction would begin immediately and will be completed by 2021. The completed facility would provide a safe placement for patients exiting treatment who require structured transitional housing to avoid exposure and minimize the spread of COVID within the community. The community is asked to provide any comments or feedback on this planned proposal by May 28th, 2020. And again, the individual that you need to contact is Joy Johnson at the planning office. Please see the tribe's website and Facebook page for a full copy of this announcement. For all other tribal departments, please continue to check the tribe's website often for updates on hours of operation, procedures for contacting the departments, and general information on the tribe's programs. Finally, the tribe will be closed on Monday, May 25th in observance of Memorial Day. We would like to wish everybody a happy and safe Memorial Day weekend, and please continue to adhere to the guidelines put forth by the Tribal Health Department and the CDC regarding recommended social distancing practices. Thank you.
Thank you, Esther. At this time, we do have Dan FEHRINGER, the superintendent of Winnebago Public Schools. Dan, are you able to hear us?
Yes. Can you hear me now?
Yep.
Okay. Again, I'm Dan FEHRINGER, Superintendent of Schools, and my prayers and condolences go out to the families of all those that have been affected this past week. It's it's hit us hard, and we continue to pray for them from our perspective. One thing I want to update everybody on, NSAA, Nebraska Schools Activities Association, did release some information permitting schools to open weight rooms starting June 1st for strength and conditioning only, following guidelines which will include a waiver signed by the student athletes and parents. Mr. James will be visiting with the coaches that will be in charge of the weight room and conditioning next week to get the plan in place, and we'll contact all the student athletes. Just as I was getting on the thing, another update from the governor's thing actually upped the number to 25 from 10. And so we'll be putting all that in. Again, we're waiting for more information regarding the other activities from the governor, so a plan can be in place for all schools to follow for all other activities. The summer feeding program will be taken over by the Kids Cafe starting June 1st. The Boys and Girls Club, along with other entities, are going to take care of next week. And Mary Kelsey is the contact person for that. The administration, we continue to work on a plan for what next year may look like as guidelines continue to keep coming. Myself and Mrs. Burrell are on the Tribal Pandemic Education Subcommittee, and we keep them current with all the plans, and they help us out. And we'll update you as guidelines continue to come in on a regular basis that change it every time we think we have something planned. And that could include summer school also as we move on. I think a lot of it's going to be based on the number of students we can have in a certain area. So we'll continue to work on that. We'll get that information out as soon as possible. Update on the building progress. As you can see, driving through town, the playground is near complete. I believe they'll be putting the turf on next week. And then also the track will be completed here in probably another week. So we continue to do that. So hopefully that at least that part will all be in. So next fall we will have a beautiful facility that will meet the needs of many of all of our students and community. That's our update for this week. Next week I'll have more information on the NSAA and some of the guidelines that will be followed. We'll have to follow as we move on with that. Thank you.
Thank you, Mr. FEHRINGER. Appreciate it. At this time, we're going to turn the floor on over here to MANOJ from Little Priest Tribal College. MANOJ, are you there?
Yes. Good afternoon, members of the community. Again, on behalf of the college and from me, prayers to the family for the lost, heartfelt condolences, and we grieve with the family. We want to extend our sincere thanks to the members of the medical staff and the hospital for continued efforts to keep us safe. Little Priest Tribal College, we have some major updates. I'm very glad to share that Little Priest Tribal College Summer 2020 enrollment has exceeded the previous highest enrollment ever. Our previous enrollment was 59 students. As of today, it is 76 students. So we had a 39% increase as of today. And today is the last day to register for new students for summer 2020 online semester. Again, I want to remind, we still have time to register for the courses. Please contact Maria Garcia or Shania at the admissions We are also conducting orientation sessions online through Zoom. Contact Tricia Wagner for orientation sessions. Students who are enrolling in summer semester also get a free tablet from Little Priest Tribal College that has been donated by American Indian College Fund. If you're a returning student, please contact your faculty for advising. All faculty got an extensive training on online instructions last week. We also have received tremendous support from the CARES Act and from American Indian College Fund for emergency student aid. Contact Ayati or Ashley Coons on the financial aid department for emergency student aid. We want to help our student in any shape or form to make sure they complete their courses during summer semester. We did have one individual test positive for COVID-19, and I'm very glad to say that individual is doing really well, and I'm in constant contact with the individual to make sure any support we can assist this employee. LPTC has started working on a college reopening plan. A task force has been set up. We are working with the CDC guidelines on college reopening, public health guidelines to ensure safety and security of the students. Fall 2020 schedule has been approved by the board, but we have not decided what is going to be the modality of the schedule, whether it's going to be a face-to-face, whether it's completely online, or it'll be a hybrid. We are working with our faculty and administrators to ensure proper modality has been decided to ensure safety of the students and staff. Little Priest Tribal College has 2 open positions. Please visit littlepriest.edu. We have a director of grants and contracts and a senior accountant positions open. We would love to have applications from the members of the community at our college. Please visit our website for any COVID-19 updates, littlepriest.edu, and click COVID-19 update. In that COVID-19 update link, we have different funding source as per the compliance from the Department of Education and Bureau of Indian Education. We have listed all our funds we have been receiving from the Department of Ed, and we also have a moving balance on the website. Underneath, we also have different links for students to fill out for emergency student aid. We are also updating continuously on Facebook, so please visit our Facebook page or on our website. And please feel free to contact me through email, call on my cell phone, or text message me if the community needs our assistance. Again, on behalf of the college, I want to pray for the family, our heartfelt condolences, and thank you, and have a safe Memorial Day weekend. Thank you.
Thank you, Manoj. Appreciate the update, and especially with the summer classes come in, we appreciate that update. Real quick here, folks, we wanted to make mention that Winnebago's Casino, Mayan Baltran, unfortunately won't be on the meeting here today, but he did say to make sure that you check out the latest updates on their website, and their website is winnevegas.com. At this time, we're going to turn our attention to Allie KARSYN from HCI. Sam Burish is not going to be with us here today, but we appreciate Allie from HOCHUNK Inc. She's the multimedia producer for helping us out. Allie, are you there?
Yes, thanks, Karen, and thank you for having me here today. As others have mentioned, we know there have been a number of families in the community who are in mourning, and we want to let them know that we are thinking of them during this difficult time. So there's one thing that we wanted to address right away, and there was an unfortunate incident at Heritage Food Town in Walt Hill. that involved customers contaminating some areas of the store. Fortunately, they did not come into direct contact with our employees. The police were immediately notified and the store was completely disinfected. All of our stores remain open. We value the safety of our employees and our customers, and out of an abundance of caution, we have an FDA-approved fogging and disinfection process scheduled. This process is environmentally friendly and food safe. Out of concern for both the Winnebago and Omaha communities, this deep cleaning fogging process is scheduled at all stores, including Winnebago, Walt Hill, Macy, Rosalie, and South Sioux City. Any additional updates will be posted at the individual store locations. With this matter, there is an ongoing investigation with the Omaha Tribal Police. We intend to prosecute to the fullest extent of the law. Early on, we implemented a number of ongoing health and safety measures at our Pony Express stores, including frequent cleanings, daily employee health screenings, professional disinfecting, plexiglass barriers, social distancing, and limiting the number of customers in the stores. We also hired additional staff to perform frequent cleanings throughout the day. At the Pony Market in Winnebago, Foodtown, Emerson, Sloan, and Atticad, we have dedicated cleaning staff and are working to hire at the remaining locations. HOCHUNK Inc. continues to participate in the Winnebago Pandemic Task Force work, including all subcommittees and the main task force. We are proud of the collaboration and leadership that is occurring across the entire tribe. So one piece of good news this week that we were able to share is about a $200,000 donation that is helping COVID relief efforts in the Winnebago community. These funds came from a Nebraska-based foundation and are being administered through HCCDC. The money will go towards rental assistance, improving internet access, and increasing access to healthy food. These were priority projects identified by the Pandemic Task Force, and we want to thank HCCDC and our community partners and programs for providing help and support to the Winnebago community. Food sovereignty continues to be a focus, an ongoing focus. Last year, we were fortunate to be able to open the farmers market in the Ho-Chunk village and celebrate with the organizers and seeing that come to fruition last year. We've been working on getting the word out about the farmers market. It is set to open on June 17 with added safety precautions in place, and they are looking for more vendors. So there is a vendor information meeting on this coming Wednesday. That is Wednesday, May 27 at 10 a.m. And this is a virtual informational meeting for new and returning vendors interested in selling fresh, locally grown fruits and vegetables, as well as handmade arts and crafts, prepared foods, and more at the farmers market. So basically anything that's homegrown and handmade, people who would be interested in selling those items at the farmers market. During this informational meeting, organizers will go over this year's regulations, the required application materials, and the COVID-19 safety protocols. There'll also be a Q&A at the end. Again, this is a virtual Zoom meeting on Wednesday, May 27 at 10 a.m. for people interested in selling items at this year's farmers market. And I can share the link to that Facebook event page in the comments as soon as I am done talking here, which will be very soon, because that is all I have. The last thing I want to say is that it's just so important that we treat each other well and take care of each other during this time. And we wish everyone a healthy and safe holiday weekend. Thank you.
Appreciate the update, Allie. A lot of information coming out of HOCHUNK Inc. And also make sure you check out their website They also have the Community Impact Engagement website. If you just search that, they also have some information posted on there as well. At this time, we're going to turn our attention to Brian Mathers from HOCHUNK Community Development Corporation. Brian, how are you doing today?
I'm doing great. Thanks, Karen. I've just got a couple of quick things to mention. One is that we do have some loans available now for people that are suffering financial difficulty because of the COVID-19 situation. There's some short-term, low-interest loans to help keep current with bills or pay off credit card accumulated debt or whatever the need is for that. Those will probably be in the range of about $1,000 tops, but that could be helpful to some folks. So contact HOCHUNK Community Capital for that. That's Tony Wood. It's 878-2192. His email is twood@hccdc.org. So if people have that need, they can contact him and he can take them through the application process. The second thing is we launched today the community's USDA Farm to Family program, which is just these food boxes that the USDA is making available to anybody that needs them, basically. So once a week, we'll have a delivery coming in on Fridays, and we have these food boxes today. It's all fresh, healthy fruits and vegetables. It's really great stuff. We weren't sure what the food was going to be, what the quality was going to be. So this week we only ordered 80 boxes. Those were quickly distributed. So we're doubling our order for next week. And we'll reserve some of those for some of the food programs like commodities. Also, we're talking to see if we want some of those to be reserved for the public health nurses or other people that would be able to take them out to high need populations that couldn't pick up their own. Give me a call and let me know. We can hold some of those back for you as well. Otherwise, we're just giving them out to people. You could drive through to the farmer's market facility and we'll load it into your car. It'll be every Friday going forward. The truck comes, they tell us between 9 and 11. Today it came right at 9 and we were able to start the distribution by 9:30. So watch for those going forward. We can adjust the amount we order each week based on the level of need. The only challenge around that is we don't have any storage for it. So we have to give out absolutely within that 90 minutes or so after they arrive there, everything that's delivered. But it is great food and there's no other eligibility requirements or anything other than people that need the food for their families. So we'll continue growing that program throughout the summer. That's going to be available at least to the end of the growing season this year. So that's really it for HCCDC. I do want to also, on behalf of our organization, offer our condolences to the families that are mourning this week. And I also just want to give out a thank you again to the healthcare professionals and the tribal leadership that is guiding our community through this process. It's a challenge. And it can get a little bit disheartening the longer it goes on. But once again, I'm really proud to be a part of this community response. You guys are doing a great job. And, it's something that we'll all get through together. Thank you.
Brian, quick question here that we have for you that I came across on our Facebook feed is those loans, are they just for local community members, or is there a certain kind of region that you serve on those, or is it national? Like if I had a cousin living in Wisconsin, are they eligible for those?
They would be if they were a tribal member. Otherwise, we just serve the Thurston County.
Okay, appreciate it. At this time, we appreciate the update, Brian, and we're going to go over to DANELLE Smith for the next portion of today's update for the question and answer session. DANELLE.
Yes, thank you. So we're going to move into the question and answer session. So I have a series of questions that have been submitted, and we will kind of go around to the appropriate person to have responses and answers to those questions. And Darren, do you have slides?
Yes, I do. So the first question here
And
is, you want me
go
to?
ahead.
Okay, sorry about that.
I was just going to remind people that if they have questions to ask, they can submit them on the Facebook Live.
Okay, here's the first question. What is the House Department's recommendation on Winnebago Powwow for this year?
So I think that we'll be working with this year's Powwow Committee to look at the necessary health measures in order to keep people safe. If that's indeed the route that they want to continue with the Powwow this year. I know John has alluded about 2 weeks ago saying that when a decision needs to be made, they will make the right one. And so I know that that will occur. So I think that if we just give it a couple of more weeks, I'm sure we'll know the outcome of what's going to be happening with the powwow. But I know that between the tribe, the health department, and the hospital, that all we want to do is to try and keep people safe. And we certainly don't want to bring people from the outside the community that could be infected with COVID and bring about an increase, to our event or anything else. So, and John might have some other insights once it gets to their part of the question and answer as well.
Thank you for that response. We'll go to the next question here. Did 12 clans get part of the PPP loan? Why isn't this being reported to the membership if they did or did not get it? DANELLE.
Yes, I can take that question. Yes, WCHS, our umbrella organization, did apply for a PPP loan. And this is a loan that's being made available by the federal government through legislation that was passed by Congress. And what it does is it provides small businesses and organizations with funding to keep employees employed and help to cover payroll during this pandemic. And WCHS did apply for a PPP loan and did receive one for both the Winnebago Public Health Department and 12 Clans Unity Hospital. And the PPP loan was a little over $2 million, like $2.3 million is the total amount. And that is calculated based on the total payroll over the course of 8 weeks for the organization. And there are some requirements that we have to meet. And at the end of that loan period, as long as we comply with everything, which we will be able to do, then that is a fully forgivable loan. So we will not have to pay that back. And the funds can be used, like I said, to cover payroll. And if there is if our payroll amounts don't equal the total amount of the loan, we can also use it to cover utilities and rent costs.
Thank you, DANELLE. The next question here is, it says, in July, it will be 3 years since the tribe took over the hospital and no certification. The council better give it back to the IHS. Did the hospital fail its recertification process?
Yep, I can address that question. So it has been, we've been going through a process of reviewing all of the conditions of participation for CMS certification throughout this time. And we did have the Joint Commission resources come in and do a mock survey for us at the end of January. That was the point in time where we felt like we had had all of the things in place in order to pass and be successful at a survey. And so we had a JCR come in and do a mock survey at that time, and the hospital actually did very well. And so we were very pleased, and it really provided reinforcement for all of the work that has been done over the last couple of years. And so we're very happy about that. At that point in time, there were still, some things that we needed to address, which will happen in any survey. They will find, some things that we need to improve upon or policies that need to be tweaked, that kind of thing. And so we have actively been working on all of those. And the COVID situation, has consumed quite a lot of time and energy and resources. So, but we still intend to be able to submit our application for CMS certification yet this year. And again, that just really depends on what CMS's schedule and how soon they could come out and actually do our survey.
Thank you. The next question here. I feel so helpless with all the funerals going on, and our gals always help the family. That's our way, but I'm scared to risk it because one of my daughters has asthma. How can we help in a different way but be safe?
So I'll try to touch on that, and anybody else can jump in, of course. I think always contacting the family and asking what maybe they can assist with, and maybe prepare something offsite and drop it off, and just say your condolences. And I think people are very understanding during this time because we need to make sure that people are staying safe. I know that we will be working with our spiritual leaders, maybe thinking outside of the box, but also keeping in mind who we are and how to keep our cultural practices and being respectful. So those should be coming out within the next week or so of some ideas that we're kind of tossing around of just thinking outside the box. But I think always right now, I think everybody understands if you're unable to be there because, you know, our first priority is being safe and keeping our social distancing and isolation. And that's really hard at funerals, especially when we all want to be respectful and want to be there for our families. But, you know, at this time, I think, you know, sending messages and giving encouragement in any way that you can through social media and texting them, you know, is always important, and is also uplifting, and prayers, just offering words of prayers through Facebook and whatever platform is used, I think is also, families are embracing that as well.
Thank you, Mona. Appreciate it. Next question here for the hospital. When will the hospital's clinic be open?
All right, I can take that one. So the clinic has been open and it has always been open. We have just tried to limit the amount of people coming in and out of the clinic, but if you need to see somebody in the clinic, definitely give the clinic a call. We are going to be working on plans to bring in people that maybe haven't had their well checks. We want to make sure people get their immunizations, that they stay on time. And so we'll be working on more of a plan on how we can do that safely. But if you need to be seen in the clinic, definitely call the hospital, and we will either we can do it telemed or we can bring you in, however your primary care provider wants to do that.
Appreciate it, Laura. Next question here. Will there be any COVID health jobs open? I seen that there was a lot of money given to the tribes.
Thank you. I can address that question. So the tribe, as well as WCHS, has received some funding through the CARES Act and through other grant sources. Right now, I think the tribe is working on a additional support for the food pantry for the community, and there may be some jobs that are available through that. As far as health jobs, we don't currently have any jobs posted, any new jobs that are directly related to COVID. A lot of the funding that we've received is going towards purchasing PPE so that we have adequate supplies for all of our staff and our patients, as well as new equipment that is designed to address the infectious disease and infection control and all of the additional cleaning and things that we need to do in the healthcare organization to keep people safe. But we are, there are new grant opportunities that are coming available, and we're in the process of assessing all of those. And we'll be continuing to assess whether new positions are warranted. And we do have a micro website, WCHS Careers, where all of our jobs are posted, so you can keep an eye on that. And then we also have our Facebook page where new jobs are posted.
Thank you, DANELLE. Next question. Are any of the deaths that happened recently in Winnebago COVID related?
So we did have a press release that came out yesterday indicating that we did have our first death related to COVID. And that's exactly how we'll continue to update the community. Obviously, we have to protect the privacy of the individuals and HIPAA related. And so that's all the information that we would be able to provide.
Thank you. Next question is, the school is done with meals and Kids Cafe doesn't open until June 1st. How do I keep my kids healthy if I have no job to feed them? How come nothing is being done about that?
So I know Dan alluded to starting on Tuesday, the Boys and Girls Club will be having curbside pickup for that week. And I believe there's been some flyers that went out indicating that they're going to be starting those afternoon meals.
Okay, thank you. Next question. May is Mental Health Awareness Month. What are we doing to raise awareness?
I believe that there's some flyers on the Winnebago Public Health Department's Facebook page of the services that are still being provided by the behavioral health program. We also made sure to put those flyers out in the seniors' lunches today, and they will go out again with the children's lunches. Our health promotions and outreach will be starting some virtual activities. Next week, they're hosting an activity on the 29th with the Educare population and having a virtual pizza party. So that should be interesting. But I also know that Laura might have some other information. There's some telehealth, behavioral health services through the outpatient as well available.
Yes, those remain. We've had those for a while now, even before COVID. We just started those probably right before COVID. But if you do need, you know, an appointment, definitely, again, just call the clinic and the nurses can help you, and also your primary care provider. And they can get a hold of your primary care provider if you need some behavioral health services or want to be seen.
Thank
Hey,
you.
Karen.
Yes, Manoj.
Just want to update on one from the priest. We just actually, the board just approved our MOA with Morning Start Counseling for our students and staff and faculty for telehealth counseling, mental health counseling as well. So a video will be posted on Facebook, and flyers will be sending out for all students, employees of Little Creek Tribal College, to make sure that we provide all the counseling needed at this particular time. Thank you.
Appreciate it. Next question here. This is a two-part question, and so if maybe DANELLE or Laura want to take this one here. The Santee tribe posts a list of individuals who are ordered to self-quarantine because they have been in contact or have COVID. Why don't we do this? Who in our tribe is in charge of that list?
Mona, do you want to take that question?
Sure. I'm not exactly sure how the Santee are getting around HIPAA. We did discuss that after seeing that for ourselves. But the health department and the hospital know who we are actively monitoring and who is in quarantine. Those individuals that we have placed in quarantine have been given information and letters stating that fact. Also, when they are completed with their quarantine, they also receive a letter indicating that they're done with quarantine. So it's not public information, but the health department is actively monitoring those individuals.
And then do we have a list that the health department, did you answer that, Mona?
Yeah, so we do have a list that we have of active monitoring cases. And those would be the ones that either have COVID or have come into contact with a positive case that we have put in isolation for 14 days.
Okay, thank you very much for that response here. The next question is, I don't even watch the news anymore because it's depressing. Any word on a vaccine? I suppose we will be last in line to get it. What is 12 Clans doing to get us first in line to get the vaccine?
So I can take that one. You know, they are currently working on a vaccine, but there are different phases that vaccine has to go through. And they have to study that vaccine before they just put a vaccine out. It has to be safe and effective before it goes out and they start using it. You know, there are reports that there will be a vaccine by the beginning of this next year. We don't know that for sure, but that's what's being reported right now. The goal is that when it's available for us, we will work hard to get it, just as we worked hard to get testing. And I'm very confident that we will be able to get that vaccine once it comes out and is available to us.
Thank you, Laura, Danelle, Mona, Angie, everybody from the health department for the health-related questions. Folks, if you do have any questions, make sure that you email covid@winnebagotribe.com. And we do have some more remarks.
Garen, there was one question that came through.
Yep. We got a couple of questions, Karen, that came in through Facebook.
Okay.
And so it looks like I received 2 of them. So I'll read those questions and then we can have responses. So one of them via Facebook. I know 12 Clans has 2 COVID tests. One result come in 48 hours and one in 45 minutes. In 48 hours, if you are positive, how many could you infect during that time? I would like to see everyone tested with the 45-minute and contained until they have results. And so, Laura, can you address the different testing options?
Yeah, and Angie, go ahead and chime in if you've got something to add. But so we do have the 2 types of testing, and I did kind of go over that in the slide. As of now, that rapid test can only be used on symptomatic patients. So if we have somebody that comes in that has symptoms, we can use that test. It has not been tested or approved to be used on asymptomatic patients or patients that don't have symptoms. And we do test some of those people that don't have symptoms if they meet some of the categories. The commercial lab tests do come back very quickly in 24 hours. And if someone is getting tested for COVID-19, they really need to be quarantining themselves. So the goal would be that if they feel like they need to be tested or someone has told them to be tested, then they need to quarantine until they get that test and they get those test results back. And that's what we tell people. And then also we are limited on the supplies of the rapid test we have. We do have some and we have enough for right now, but as I said in my report, we have to make sure that we have enough for long term. And we continue to work with to getting those tests, but everybody wants those rapid tests and everybody wants testing supplies. So we do the best we can on a daily basis to get those tests in. You know, once we get enough tests and once it can be used on all patients, symptomatic or asymptomatic, we will do that. But right now, those are the guidelines.
And just to kind of go off what Laura said, is anybody that's getting tested, whether it's with the rapid or the one that's sent to Quest it takes 24 to 48 hours to come back, is we do want they are instructed to socially isolate during that time frame because we don't know if the result can come back positive or negative. So we have to err on the side of caution that it's going to come back positive and to limit any further exposure. So it's really important, anybody that's getting tested, that you do socially isolate till your test results do come back to limit any exposure you have, one to household members or to any other community member.
All right, thank you, Laura and Angie, for responding to that question. The last question that I have here is, are the 12 Clans MVO protected with PPE as the hospital staff? Also, do they receive hazard pay? Mona, do you want to address the MVOs?
Sure. So the MVO program is under the Medical Service Division of the Winnebago Public Health Department, and each member has been given the necessary PPE that is required for their position. We are looking at some different innovative solutions for the drivers to try and protect them. So Cindy and I are bouncing around some little ideas because obviously we want to keep them safe. They are in a motor vehicle operating situation and they still need to be able to hear their patients. So we are going to be trying some changes to their driving area and we'll see how that goes. Keeping everyone safe, of course. And then the WCHS is working on developing a hazard pay structure that will be presented to the employees as soon as the WCHS board approves it. We value every member of our frontline staff, and we know that it's very scary times, and we do look for outside of the box ideas, and we welcome any if others want to send them to us, we would surely look at them.
Okay, thank you. Garen, I think that's it for the questions that we have.
We had one just coming through here, and I'm not sure if let's see here. This one came in through the YouTube stream. Will you be getting the test to check for antibodies? I'm not sure, but maybe you folks know that one.
And I can take that one. We have not received that. We do have the equipment to be able to do those tests, but we have not received the kits in order to do those. And once those come out and they're made, they've been studied a little more and there's more information on them, then we will try to obtain those tests when they are made more widespread.
Thank you, Laura. Now we're going to turn our attention here to the tribal official questions here. And the first question will be directed towards the CEO, Esther Mercer. Esther, are you on?
Yes, I am.
Okay, the question is, how many employees of the tribe have COVID? I heard facilities and the youth shelter shut down because all of their employees have it. Is that true?
Well, thank you for that question. Due to confidentiality, the tribe is not able to release data that may violate employees' rights under HIPAA, which includes disclosing department-specific information. In general, I'll state that the Winnebago Tribal Organization has, unfortunately, had employees who've tested positive for COVID-19 and have been subject to health department quarantine or self-isolation orders due to possible COVID-19 exposure. We continue to work with local health officials to evaluate all incidences and have adhered to their recommendations for a healthy and safe workplace. Recommendations range from quarantine or self-isolation to temporary closure for professional sanitization of the work locations. In addition, the tribe adheres to internal policies as they relate to health and safety in the workplace. Be advised that quarantine and self-isolation orders are enacted as part of protected health measures and do not always equate to a confirmed positive. Thank you.
Thank you, Esther. This next question here is directed towards the pandemic chairman and the vice chairman, John Snowball. The Nebraska governor said he has no problems with the Omaha tribe's checkpoints. So why are we not doing them for our people?
So thank you for that question. This is an ongoing thing, the security portion of this response to the pandemic. And myself and the chief of police, we're in daily contact on how things are going and what we should do next. And this has been up for conversation, and doing a road check on the state highway 77, 75 would take a lot of resources, and resources that we don't have right now. And but there's other ways that we can funnel our community through one area that a roadway that we do have control over, as far as BIA roads and village roads, that we can accomplish that without dealing with the traffic from 77, 75, which is heavy at times. You know, it would be really difficult to do. And just to be clear, that the Omaha Nation has done something similar to that. They have control over their own roads and have funneled the way in and the way out to their community to the way that we're thinking. So me and Jason, our Chief Lawrence, are talking about that, and if it comes time, you know, we're gonna take that action. Thank you.
Appreciate it. And this next question here, does the Winnebago tribe support the Ogallala and Cheyenne River Sioux tribes on their methods of preventing the spread of COVID?
So I'm on the board of directors for Intertribal Buffalo Council, and on that council there's 69 tribes, and I represent Winnebago, and as a regional director on that board, and we just had a meeting today, this morning, and we've been meeting a lot, trying to help the tribes, and there's always things that we need to discuss when it comes to other tribes, and I had a lengthy input to the rest of the board on, we're real respectful to other nations. We understand that they have their people and they have their land and they have their own goals and needs. So we're real respectful. That I would never speak on another tribe. That I respect what they do and that's their way and then that's their right. That they're a nation. So anything that they do, I would respect it, and then I would never speak on another tribe's needs or their wants or what they're doing, but just have that respect towards them, real high respect.
Next question here for the council. Since we can't come down to the tribal council chambers to listen to the tribal council meetings, can you make all council meetings public? What is the council trying to hide?
So our mid-monthly and our monthly are automatic, they're automatic open to viewers. And through this, the council took action that we no longer meet in person, that it's not smart for all of us to meet in one place, that we need to protect ourselves, to continue to operate, to continue to take actions as the government. So all of our meetings are online now, and to my knowledge, you can reach out and get the link. And if you're a tribal member, you can listen in, but we can't make it public like the monthly and the mid-monthly as we deal with HR matters and we deal with matters of financial that can be sensitive, that should not be public. Thank you.
Next question. What's the plan for Bago Powwow?
So I had thoughts when this got brought up earlier that that's real important to us, a real important day that we celebrate, and to keep it going, we got to keep it going no matter what, no matter what, we're going to do that. And what that looks like, we don't know, and how it's real important to us. What happened, that to understand there was one time that we didn't have a home, and that we went through real hard times, and our membership, from the youngest to the oldest, they fought, and they didn't give up till we got here, till we got to our homelands, this place that has good medicine for our people, that is as much a part of us as we are of it now, real deep roots here. And so we're going to continue with that, and it's going to be safe, and we're going to make the right decision when it's time to make that decision. But we're going to continue, because we understand how important that is, our annual celebration. Our war chief, Chief Little Priest, what he done for us, and what it means, and our home here, it's a lot, and we're going to continue, we're not going to break that. We're not going to break that annual celebration. We're going to have something, and it's going to be safe, and we're going to make that right decision.
Next question. Why is the council forcing Winnebago to open back up? It isn't safe yet, and they are risking the employees' health.
So the Winnebago Casino is gonna take table action to open up, and the council is the only one that can open the casino. And the GM, he has brought back his employees. He has been fortunate enough. We have been fortunate enough to come in on that PPP loan as it was discussed before. So we have funds, to pay our employees and hazard pay and to try to take care of them. And so we have that ability, and I believe they're looking on the side of that it might open, but I can only speak my own thoughts. That'd be hard for me to use my vote to open the casino right now. As far as it seems like we're just coming to our community. So we haven't discussed that at the table, but that's where it's going to happen. That's where it's going to happen, or it's not going to happen. Thank you.
Do tribal members get a say in what happens to the CARES Act money, or is it going to go to HCI?
So that we have identified, the tribal council has formed the task force. We understood that this was a situation that took unprecedented collaboration on all of our entities. So we formed that, and I had no intentions of being on that task force. And in their first meeting, they called upon me to be their chairman, and I took it serious, you know, and then that they would call on me, and that I would accept nothing less from each of those 5 members than their full engagement and their full utilization of all the resources that are available to them. And I made it known that to expect the same from me, you know, nothing less than my best, you know, that I'm going to do that. And I encourage the membership to expect nothing less from me. You know, I'm going to keep going. And so a lot of work, you know, a lot of work has gone into this budget, and it was forwarded to the council, and the council understood that, and it was passed, you know, and it was passed without anybody against it. You know, all of us agreed and said, yeah, let's go forward with this, and it's gonna focus on our community needs and taking care of each one of us. Thank you.
A lot of rumors about the deaths in the community. I think for sure we need a community healing, but can you clear up the rumors? Are they COVID related? I don't care about HIPAA. We are a small tribe. We shouldn't be worrying about laws. We have our own laws. Why are we not communicating daily? I heard there was a murder this weekend. Where was the communication then?
So we need to be respectful to the family and respectful to the things that are happening. That there's an investigation involved in that, and then there was a lot of officers involved in that happened over the weekend, and we're dealing with it and in the right way to make sure that the truth comes and justice comes, and well, you know, whatever it needs to look like. So the officers are trained, you know, they're trained to be that way, and so they have been. So it's really impressive, and even the situation, you know, it happened at night, and it was raining, and it was muddy, and it was dark, but the officers, you know, they didn't give up. They kept going, and it was really impressive, and I was proud, and so that we'd be able to find them, and that this is going to be dealt with, and in a good way, you know, that it was a real bad situation, but the way our officers are, you know, they're real good people that fill them positions, and looking at this community healing, you're right, you know, and that's our way to gather and to support each other, you know, and to help each other's families that were real precious to each other, and there's ways, you know, there's ways to show that in this time of social distancing. Even my neighbor Mona, she had a loss in her family, and I couldn't you know, I had to protect my family and protect her family. So I saw that her lawn wasn't mowed, so I tried to take care of that for her. Understand that they was doing a lot, you know, trying to take care of their relative, and that she takes on a lot for this pandemic and in her position. So there's ways, you know, that you can try to help each other and be safe still. Thank you.
How many tickets have been given for curfew violations? I think it was a good idea, but nobody is listening to it anymore. The council should publish the violators in the Winnebago Indian News and social media. Use the fine money for food for our people. So the people have been arraigned to court. They've been having to go to court for these tickets, and I want to say that nothing's perfect. You know, we try to do what we can. There's no perfect answers, but do what we can. You know, don't leave that out. So this is what we can do, and we have this many officers, and they're doing their best, and it is, you know, they're writing tickets, and people are still out, and I understand that, so I'm just trying to touch on that, you know, that this isn't the time to ease up, you know, this is the time to try to really get through this together as a community. It's going to take all of us. It's going to take each one of us. You know, there's no single action from the table or single action from the task force that can protect all of us. It's going to take each one of us protecting each other. Thank you, John. We have some questions here that came in via Facebook here, and it's regarding the HOCHUNK Nation is helping their tribal members with $1,200. Are we not doing anything like this to help our members with financial hardship?
At this point, I did see HOCHUNK Nation and other tribes making those payments, and unfortunately, the Winnebago tribe it doesn't have the money that the other tribes have. We have enough to take care of ourselves, and we're real smart, real smart with our funds and how we spend them, and how we're going to be better after this, better as a community, and how we're going to be stronger, and really looking at our weaknesses in our village, and how we can turn those into our strengths. So like I said, all those, a lot of work has been done, and we're going to start seeing things happen from that, and I feel real good about it, and it goes back to what I said about other tribes. I would never speak on what they do. Real respectful like that, and good relationships, and so I'll say that much.
Thank you. This next one here let's kind of piggyback on this one. The tribe has a loan, but there's guidelines on that. And then Brian Mathers had mentioned something about loans as well. And so this one came in Facebook. I'm going to need more information on taking out a loan. Where do I find this information? Brian.
I would just email Tony Wood, twood@hccdc.org, and he can provide you the details about that personal loan opportunity.
Thank you for that. And at this time, that's all the questions that we had coming on. Closing remarks, Chairman of the Pandemic Task Force, John Snowball.
So I thought about what I could say, some words of encouragement for all of us. And, yesterday my neighbors, the Bears, Sean and Geraldine, they had a birthday, real good time. And, but I stayed away, to protect them and to protect my family, and understanding that's more caring than anything. And I have a faint memory of my grandma, Grace Snowball. When I was a little kid, she would come to me and my brothers and ask one of us to thread her needle, and we would fight over it. And she didn't need us to do it. She was trying to encourage us, encourage our growth and our confidence, and a teaching so subtle and caring that it's still with me today. And my grandfather, my father's father, Edward Snowball, I never had the opportunity to know him, and his journey ended before mine started, and that our older people are real precious to us, and when somebody tells me a story, I really listen and admire that, and so those are the ones we need to protect, and that they're real important to us, and those are the ones that are at risk, and I want everybody to take this serious, and understand that this isn't a time to ease up. We need to keep going, and that's what we'll do. Thank you.
All right, appreciate it, Vice Chairman Snowball, and everybody that joined us on the call here today. DANELLE, we appreciate it, and as we head into the weekend, we wish everybody to remind also to use social distancing, as well as make sure to use those protective measures. And for more information, make sure you visit the WinnebagoTribe.com, as well as the other entities for the latest updates. And you folks stay safe out there, and we're signing off. We'll be back online on Thursday the next week, and so that will be Thursday, May 28th. Thank you.